Dear physio colleagues, I would like to share a few of my thoughts on shoulder dysfunctions. Now, over the period of years when I have been treating individuals with shoulder dysfunctions, there are a few of things that have come to my notice which I would like to share it with you. When we look into the shoulder dysfunctions, most of the time we look into the glenohumeral aspect, the acromioclavicular aspect, and the sternoclavicular aspect, and also the scapulothoracic aspect. But one thing we have to see is also the regional interdependence. The areas surrounding the shoulder or associated with the shoulder have to be given equal, due, or very important or very significant contribution even in our assessment part. Whenever we assess for a shoulder dysfunction, it would be very wise to also rule out the cervical as well as the thoracic components, or the interference of cervical, or the contribution or the significance, or understand the significance of the cervical and the thoracic spine in shoulder mobility. So what we usually see is it could be occupation related, or it could be postural related, or it could be a habitual sign which could cause the cervical spine and the thoracic spine, or the thoracic spine, which could contribute towards the dysfunction of the shoulder. And so when we either look into the cervical or the thoracic and the shoulder region, when especially in shoulder dysfunction, it's always advisable to rule out the cervical mobility as well as the thoracic mobility when we counter into the shoulder dysfunctions. The reason being the skeletal connections as well as the muscular connections, the facial connections, and the neural connections that we have with the axial skeleton in relation to the appendicular skeleton. So this has a big role when we discuss about shoulder dysfunction. Even when we talk in terms of occupation. So probably as a part of the occupation, a person might be having his cervical spine in a particular position which may not be appropriate, or which may be a deviation from what we call as an ideal posture or a normal posture, which could reflect as a shoulder dysfunction. Or it could be even a hunchback, or it could be a stoop posture, which leads to a dysfunction of the thoracic spine as a primary component, which later reflects as a secondary dysfunction at the shoulder. Probably the patient being more sedentary at the thoracic level might lead to more of a stiff back, but he does not realize it, but only to realize it when he tries to move his shoulder, which is the more active component in his lifestyle, and then he realizes that there is a more restriction from his shoulder side. When such patients appear to us, it would be always wise to evaluate and treat also his thoracic spine, provided there is an involvement of the thoracic spine, as well as also to rule out the cervical component, and also not to rule out, not to mention out even the muscular aspects of the same, the soft tissue aspects. All the soft tissue aspects also needs to be given due importance in order to treat shoulder dysfunctions. Thank you.